So Dr. Zalewski, let's start with radiation, and can you compare that for me, and then we'll give Dr. Easton a shot at the same thing. In terms of the big side effects that most men want to know about, potency and continence when it comes to radiation, how does that compare? And is there a difference between external beam and brachytherapy or seed implants?
Well, generally speaking, the differences are not dramatic between external beam and brachytherapy. So I think we could make it simple in terms of looking at these general side effects. What we call late side effects, which are the more important ones, they're temporary side effects from these treatments, such as frequent urination, urgency, a little frequent bowel movements, but these resolve a month or two later. So the more meaningful ones that we should be talking about are those, what we call late side effects, which could pop up a year or two later, 3 years later. And these include the following: rectal bleeding, which is seen in about 5% of patients. So that would mean during a bowel movement, a patient could see occasionally some blood in the stool. We're not talking about serious hemorrhage, but it's certainly annoying as well, and it could take time, meaning it could take a year or two with conservative management to get better. Incontinence of urine or stool, fortunately, is a very, very low risk. Even the need for pads among the patients who get treated is an extremely low risk. And it's one of the actual advantages of radiation over surgery. On the other hand, with radiation-treated patients, there is more than surgery, this inflammation-like syndrome where patients have more frequency, urgency of the urination compared to surgery. And so it's 6 of one, half a dozen of the other. Potency, in our experience in looking at patients who've been treated with either kinds of approaches, generally the same. Certainly it depends. The same as a radiation-based approach or surgery. It, of course, depends heavily upon the patient's age and their baseline function. Very often, patients who get treated with radiation are often older and their sexual function is declining. So it's hard to really make straight comparisons. But overall, depending upon the age and the baseline function, about 30 to 40% of patients develop permanent impotence. The good news is that there are medications out there which are quite effective in at least improving erectile function. Fortunately, with all these new technologies we talked about, the risks of very serious injury to the rectum, to the bladder, to the bowels, which did happen maybe in the 50s, 60s, and 70s, is something almost unheard of nowadays. And those risks are actually about less than 1%.
Well, that's a good point, though, that you make, is that you have to consider what the baseline was going in. If you just ask the question afterwards, well, are you potent or are you continent? You have to know, were you before? It's the, will I be able to play the piano after this, doctor? Well, that's great. I never could before. If you're old enough to remember that, you know Henny Youngman. But you have to know what you're going into to begin with. Let's talk about surgery. We hear a lot about a couple of things. Nerve-sparing surgery, the procedure that's been developed now, it's been around for some time. And then, of course, the hot area is robotic surgery. Differences, advantages, disadvantages?
Sure. So I think Dr. Zalewski gave a very fair appraisal that you basically pick your poison. And the first thing that I tell any of my patients is that if you expect to be back at your baseline after treatment, whether it's for urinary function or sexual function, you will absolutely be disappointed, because that's a misperception. You can't go through treatment for prostate cancer and not have some functionality impacted in some way. So the important thing to remember is that all of these functionalities change. So the big difference between surgery and radiation is that with surgery, there is a much higher risk of incontinence. I tell every man that after surgery and once the catheter comes out after healing, you will go through a period of incontinence. I say it happens, but it's very rare that a man is dry right when his catheter comes out. We tend to remember those patients, but it's not the routine. So I say don't plan on being dry. And if you look at the curves for recovery of continence, they're age-based as well. But if you take the typical patient that we operate on that's on average age about 60, the average time to get out of pads is a couple of months. And that's a significant impact on quality of life. Now, that doesn't mean they're all in big, bulky diapers the whole time, but still, it's a difference from their baseline. They don't wear a pad going into the operating room. After they come out, they will go through a period of time where they have to wear some form of protection. And 2 months is 50-50. Half of the men are out of pads, half of the men are still in pads. So by 6 months, it's up to about 75%. And then by a year, it's up in the mid-90% range. Again, that'll vary a little bit by age. Most men are continent at their baseline. So it's a process of recovery. And as long as you're honest with patients and you don't tell them, oh, no, don't worry about it. We're going to do this nerve-sparing surgery by whatever fancy approach. You're going to end up continent and potent, and it's not a big deal. If you tell patients that, you're going to have a lot of annoyed patients because that is not reality.